my name's Sierra Norman. I graduated in 2019 from Bryn College with a degree in psychology, and I double minored in biology and child and family studies. And then this past May, I graduated from Hopkins University with a master's degree in biotechnology and a concentration in health science intensive. So I'm from Idaho. I'm from rural Idaho specifically, and we didn't have a lot of resources in terms of college applications. So I think what you guys are doing is great to have that resource for students, but I just kind of started looking online, seeing what options I had. I went to my counselor, and I'm from a community that really predominantly practices one religion, and they were surprised I wanted to go to college to get education and not find a husband. And so just to paint a picture, I guess, of the kind of help we had at our high school in terms of going to college. And so I got online, I started Googling, I guess, what I knew I wanted to be a doctor. And so I kind of was looking for schools that had good pre-med programs or good, health programs that would, provide a good foundation for my future career. And yeah, I kind of went from there. It's been a long time, but I think I probably applied anywhere from 12 to 15. I applied to all the Ivies. I applied to a couple of the Seven Sister colleges, and I think that's about it. Most of my schools were on the East Coast area. I just kind of wanted to get away from Idaho, try something new. So, yeah. I did apply to Brown early decision, and then I was deferred for their regular cycle. So in general, I did choose on location. Like I said before, I just wanted to get away from Idaho. So most of my colleges were on the East Coast. In terms of looking for colleges, I got to the point where I Googled, most beautiful campuses, most colleges with the most beautiful campuses, and applied to some of those just because I didn't have any resources really to, aside from the internet. And so some of the colleges I applied to, like Brown, I want to go into pediatric psychiatry, and for their medical school, they have a really good pediatric psychiatry program. So it was way, way in the future, but, I applied there, I guess, to get, start networking. And, but yeah, most of the schools I was either looking for, good pre-med programs or any connections to pediatric psychiatry. Tuition really was important as well. And I was able to go to Bryn Mawr. I got the presidential scholarship to go there. And so that was ultimately what helped me make my decision to go to Bryn Mawr. So a lot of my extracurricular activities were with community service. I started my community service when I was 10 with a PB&J week food drive where we collected peanut butter and jelly for our local food banks. And so I had the longevity of my community service aspects. Aside from that, I did some more with childhood hunger in Idaho. I had some programs that were about bullying once I got into high school, and a lot, if I remember right, it's been a long time, but on the college apps, they ask, is there anything unique about you or something? One of the questions is an optional question. And I spoke about my high school experience. Living in such a small community, I ended up having a lot of issues with the education system, I guess, in Idaho. For background, Idaho consistently ranks last in education rankings nationally. And so we have a really terrible go-on rate. And in rural communities, if you want advanced classes like AP classes, dual credit classes, or advanced language classes, you can take them through something called Idaho Digital Learning Academy, which is an online school, but it's an extension of the public schooling system. And so that's really the only way you can get that in rural schools. But on the same hand, rural schools are punishing students that take advantage of those opportunities by saying that, well, if you do that, you can't participate in school activities like student government or like cheerleading. And so, they're making high schoolers choose between academics or activities. And there was a big issue with that, and the American Civil Liberties Union got involved with trying to update the policies so that students couldn't be penalized for taking these advanced level courses. And so that's what I wrote about a lot in my application as well, is just my experience with the education system in Idaho and trying to update these policies to protect rural students. Yeah, I did take a couple AP classes online through the Idaho Digital Learning Academy. We didn't have any offered on campus. In that same vein, just with the I didn't really know what I was getting into. I didn't take the AP tests because I didn't really realize they were something different than, the regular final you took for the class. It wasn't really ever discussed. And so it's just a lot of those inconsistencies with like the way education is presented to high school students. You have to really do a lot of research for yourself in Idaho to figure out what you need to do to get what you want. I know when I got into Bryn Mawr, I actually had a handwritten note from the president about my college situation, or excuse me, about my high school situation, that she thought, it was really cool that I stood up for it. And so obviously that stood out to her on my application. When I applied for Johns Hopkins, again, that was something that came up in my interviews, and our advisors, they thought it was really cool. It was something that stood apart. And for Johns Hopkins, they mentioned two things, I guess, that were unique. And one is my high school situation. The other one is I've been doing pageants since I was probably about 12 years old as well. And that's something they don't see a lot in college applications, or at least people don't put it a lot in their college applications. And so having those kind of unique hobbies, unique, experiences are something that colleges, if anything you have that stands out, that's not something that's going to be what everybody puts on there, it's very helpful. Looking back, I think I probably could have prepared a lot better, but I tried to do it myself. Just got one of the, ACT books at Barnes & Noble and read through it, did some practice tests, did some practice problems. But yeah, again, I think that, high school really can help prepare you for those things, but ours really didn't. No, I only had one interview. It was for my early decision at Brown, and it was an in-person interview here in Idaho. And I think it was mostly just maybe, what are your interests? What do you potentially want to major in? Do you have any idea what you want to major in? Yeah, I can't remember if she had access to like my application where she could see, community service, all the background information. But it's, it's mostly questions about you, not, it's questions I guess you should have an answer to, because it's about you. It's nothing really out there more, they're not going to ask what year was our college founded. It's questions about you, questions wanting to get to know you and see if you'll be a good fit for their school. As I majored in psychology at Bryn Mawr, and I knew going into Bryn Mawr that's what I wanted to major in. With my community service, as it progressed, throughout high school, I was involved in a lot more experiences that were geared more towards mental health and mental health for children. And so, yeah, I knew I wanted to go into psychology, but I also wanted to have that, pre-med aspect of it. So I was in the pre-med track, and I minored in biology to have some of those good core science courses to help substantiate, I guess, my foundation. Yeah, so there are the required courses for your pre-med track, your general chemistry, organic chemistry, biology, physics. Some prefer a calculus class and biochemistry. So those were all, the regular courses I took. And then I was really interested in biology, so I explored those classes a lot more. One of my favorite ones, I guess, was a biology and public policy course I took my senior year. So you're, talking about the aspects of biology in public health and how it relates to policies. And it was really eye-opening, I guess. I think it was a good aspect to even carry over into the field of medicine, because there's, so many things intersect and they really play on each other. Bryn Mawr, they did have a pre-health program, and Bryn Mawr actually also has like a post-bac program. They call it for like career changers. If you maybe minored, if you didn't take those pre-health courses in your undergrad, but you've decided you wanted to go on and be a doctor, they have a year program where you take all 5 of those core classes in a year for the science classes. And so their pre-health department is good, but I didn't really have a strong science foundation coming, from rural Idaho. And so I did struggle in my courses in the beginning, and they didn't have a lot of, help for, if you were struggling, they kind of pretty much said, well, then this isn't the career field for you, kind of. And so they didn't have, they did have some networking opportunities. I guess they had a program called the Health Interest Programming, HPI, that we were able to network with local either doctors or, people that would come in and talk about their professions. I was on a committee for pediatric medicine, so we had the co-chief of Children's National in the emergency department come in and talk about pediatric health and those pediatric patients he sees in the ER. And then we also did a women's health aspect of it as well, where we had a doula that goes into to meet incarcerated pregnant women to help them through labor and through their birth, and just there's so many aspects, I guess, of being pregnant in incarceration that really needed a lot of support. And so we were able to network with a lot of really different varieties of fields in medicine and in healthcare. And so that program, I guess, through their pre-health society was a good networking opportunity. Yeah, Bryn Mawr is a very interesting environment. I really grew to love it. I mean, they have a lot of traditions that make it a very unique college. It's also a historically women's college, and so they're very into like female empowerment and being strong women, which was great. Even with that, I did have experience in the science department, some like kind of sexism from some of the male professors, which being a women's college, you don't think you would experience there, but nonetheless, I did have some really nice teachers as well. I've had my professor actually for the bio and public policy course, she wrote my letter of recommendation for Johns Hopkins. She was really sweet. They, if you can form those connections and form those relationships with the professors, and for them to get to know you on a personal level, not, just a face in the sea of their classroom, they are really great. They do want to help you. They want to help you succeed. And I was really able to see that a lot more at Johns Hopkins. Bryn Mawr was a small school. I mean, for all 4 classes, there were 1,300 students, so it was on the small side. But when I got to Johns Hopkins, my entire class, it's a year program, so there were just the one class. There were 35 of us. And so we were able to form much closer bonds with our professors and, interact with them, more one-on-one. And so I guess it boils down to just having that time with the professors to be able to get to know them on a more personal level. And they're really helpful. They, for the most part, they do want to see you succeed, and they'll be willing to help you through that. I do think the program I went to at Johns Hopkins was for a master in biotechnology, but the health science intensive concentration I was a part of is specifically to help boost your academic record for medical schools, kind of help with GPAs, as well as just having that higher experience with a higher level courses, more rigorous courses. And I think because that's like the driving force of the program, the professors were so much more supportive with, if you needed help or if you needed letters of recommendation or, whatever you needed, there was a lot more support, I felt like, at Johns Hopkins than there was at Bryn Mawr. So it's, my major at Bryn Mawr was psychology, and it was actually one of the few majors that you didn't need to thesis in to graduate. And around my junior year, I decided, I think I want to thesis. But the psychology department at Bryn Mawr, it was relatively small, I guess, compared to some of their other departments. And all of the teachers I'd formed relationships with were either on sabbatical year my senior year, or they had retired. And so since it was such a small department, there wasn't that many, professors to thesis with. So I guess that was maybe a downfall of it, but there were still a lot of great, kids in the program. The classes were really interesting. One of my favorite classes, I guess, in the psychology department was a autism spectrum disorder class. And so we spent the whole semester just talking about autism and really understanding the disorder and the people. And I think I really liked those classes, I guess, that focus in on one topic, and you just spend a year learning about it from all different angles. And so that was a pro, I guess, but it was a small department as well. Not necessarily through the college, but while I was in the community that at Johns Hopkins, I was able to connect with some doctors from Children's National, and we're working on a paper right now about telehealth for mental health, and now the impact of COVID-19, because telehealth has become, so much more prominent. We were researching data from, I think, April of 2016 through February of 2020, and they maybe had about 500 cases for telehealth in their mental health department, mental health in their telehealth department. And from March through June, they've had 11,000. So it's just been such a significant increase. We're writing our paper, and we've submitted the abstract to the American Academy of Pediatrics, and it was accepted for their national conference in October. So we get to present on the topic, share our data on that. So that's the only research opportunity I've had so far, but it's been really interesting. It's been really eye-opening to be looking at, telehealth and what's happening right now with the global pandemic, being able to be a part of that. Yeah, I've had a couple internships. They've been mostly in the mental health field. One was at a local clinic here, and I was just kind of doing paperwork, doing some of the filing, administrative things. I was asked to do their adolescent workshop or help with their adolescent workshop, just was around the office helping as what I could. But my internship that really, really helped solidify my career choice, going into the field of medicine, pediatric psychiatry, was at this place. It's called the Children's Center. It's in Salt Lake City, Utah. It's a mental health clinic for children and their family. I think they help like 2,000 families a year. It's the largest one in Salt Lake City. And most of it's subsidized. They hold galas and all these different fundraisers so that families, if they're not able to afford it or if they don't have insurance, their children can still get the help they need. And I was part of their their therapeutic preschool, and they have they call them TPSs, their therapeutic preschool specialists. That it's group therapy, but it's really play-based because these kids are 3, 4, or 5 years old. And so the therapy sessions, they're play-based, and it's in a group so that they have comfort. And we're there, the interns or the volunteers, we're there to help model positive relationships with adults for these children. And some of them do have just emotional or behavioral disorders, but there's some that have been through just horrific traumatic experiences. And so it was really just, you had a really range, I guess, of kids in that program. And so it was really impactful for me. I was there, I think, for 300 hours throughout the summer. And it's what solidified, I guess, my career choice and the career field. Yeah, I did. I worked, my senior year, I worked we had a preschool on campus. And so I worked as a classroom aide in the preschool. And they also had a language program kind of too for students that struggled with language skills that I substituted in. And I had a couple of remote jobs as well. I was a director of social media for a company out of Scottsdale. And I also work for, it's a company called Rocky Mountain Recreation. They do like site amenities, playground equipment. So I was just helping with bids, entering orders, some of those just things that are good to do, I guess, remote because I was away at college. I worked maybe 10 to 15 hours a week, longer, I guess, as I got towards the end of college. And yeah, I guess being able to do it, I think it boils down to time management, having, whatever works for you, whether it's a planner. I have a lot of apps, or I shouldn't say a lot, but I have apps, I guess, that I use to help keep things organized so that I know when stuff's due so that we're not ever running late or turning things in late. My freshman year was definitely my hardest year, just getting into the groove, I guess, of the college level courses, especially science. I ended up taking my general chemistry my freshman year, and we hit the ground running day one, and I didn't really have a strong foundation in chemistry. I actually wrote about this in one of my medical school secondaries, but to paint a picture of the chemistry classes at my high school, the only time we ever used our textbooks was as bases when we would play kickball. And so I was not prepared for the college level chemistry courses. And so freshman year really was a struggle trying to keep up with what we were doing in class while learning like the foundation that I needed to succeed in chemistry at the same time. And so, yeah, definitely freshman year trying to just get into the groove. I think a lot of people struggle with freshman year though too, because it is, it's a transition to college. It's a big one. Bryn Mawr was very small, so I was just able to walk. I did have some friends that had cars later in the year, but the town of Bryn Mawr was pretty small. It was pretty close as well, so everything was within walking distance. I did actually. You had to get special permission to live off campus at Bryn Mawr. From what I understand, I think it's just because there's such a high concentration of colleges there. We had Villanova, Haverford, Swarthmore, UPenn. I don't know. There were so many colleges within like a 10-mile radius, and so there wasn't a lot of opportunities for off-campus living. And so it was all on campus. Your freshman year, you more than likely were going to have roommates, but all of the upperclassmen typically had their own dormitories. I want to be a pediatric psychiatrist, so kind of meld the working with kids and the mental health aspects together. This program I took with Johns Hopkins, it pretty much held your hand through the whole application process for medical school, which was really nice. We've been working on, you have a personal statement that's, you pretty much answered the question, why medicine? We spent a year pretty much writing that. It's only, I think, 5,300 characters, but we write it, our advisors would read it, our peers would read it, and so it was really proofread so that, you know, what we were presenting to the medical school was, you know, the best version of us. And so you have your personal statement, and then within your primary application, the other, you know, big chunk of it is what they call your list of experiences, or list of 15, because you can have up to 15 experiences. So I, you know, wrote about my time at the children's center, or I wrote about my experiences in high school. And for most of them, you just have a short little blurb of what you can say, but you can pick 3 of them to be your most meaningful, and then that opens up more space for you to kind of write and elaborate on why that's most meaningful to, you know, developing you into who you are today. So yeah, so that's pretty much your primary application. Then obviously your grades, your transcripts, and then you take the MCAT, the medical school admissions test, and that makes up your primary application. And after that gets sent out to the medical schools, some of them will screen, so they'll look at your primary application first before they send you secondaries, which are more specific questions on like why our school, or, you know, is there a specific specialty you're interested in? So I've just finished that secondary process. I submitted those to all the schools, and now it's kind of the waiting game, I guess, for interviews. I do have an interview, my first one, at the end of October, but this part of the cycle takes about a year. So decisions aren't usually given. They're given anywhere from like October to March. Yeah, my classes at Johns Hopkins were at night, and I was there one night, and we all got an email that classes were canceled until further notice. And there were 10 kids in my class. You know, our cohort was, you know, 30, and that was the last time I saw anybody from my class. It was just so sudden. And so, you know, classes were obviously canceled. Graduation was moved online, or I shouldn't say canceled. Classes weren't canceled. Classes were moved online, and graduation was moved online. At Johns Hopkins, I did have an apartment because it was a master's program. We didn't have on-campus living. And my mom flew out. She helped me pack up, and we road tripped back home. So yeah, so classes, and I was also supposed to take the MCAT right around the time that COVID got really bad. So, you know, the MCAT was canceled, and I think there's just been the MCAT situation was a lot of a stress for a lot of pre-med students this cycle, because, you know, it was canceled, but then when it was opened, the registration system was opened up, I guess, to reschedule once things started opening back up. So many kids logged in to register that the system crashed that day, because there's only a certain number of slots for medicals, or for the testings at certain testing centers. So if you want, you know, a certain slot, you got to get in there really fast. So I was up at 4 o'clock that morning to get a slot, and I didn't get a slot until probably 4 o'clock in the afternoon. It was just you just had to sit and wait. You were in line pretty much. And so as soon as it opened for you, you had a minute to make your decision, or it would boot you to the back of the line. So that was a stressful situation on top of an already stressful test. And then taking the test too, you had to, in the testing center, you had to wear a mask. So that's just kind of a little bit getting used to, I guess, wearing the mask while you're in that stressful situation, practicing with that. Yeah, just a lot of opportunities, I guess, have either been canceled, or this American Academy conference, I was supposed to go present in San Diego, but now it's been moved online as well. So just the precautions that people are taking to make sure that, you know, we kind of stop the spread of COVID as much as possible. It's canceled a lot of things, but it's understandable. Yeah, I guess I felt as prepared as, you know, I could. I think when you're studying for that test and you have your test date, you know, you're ready to take it, you know, that test date. But then let's see, I think it got pushed back 3 times. I was originally supposed to take it in January, but for personal reasons I couldn't. Then it was March, then it was April, then it was June, then it was July. And so I think just having it pushed back so many times, you get a little burnt out, I guess, with the studying aspect of it, and, you know, trying to keep up on top of everything. But I still scored higher on it than I did on my practice test, so I was happy about that. But yeah, I think there definitely could have been, you know, better conditions to have prepared in. Yeah, so I was supposed to start shadowing physicians at the Children's National Health System, and the clearance process for that is 2 months. You have to get TB tests, fingerprinting, all that kind of good stuff. And so I just finished the 2 month clearance process the end of February, so I didn't really get to shadow hardly anybody within that system. So that was kind of a bummer. And then coming back here, we don't have a lot of opportunities to shadow in this area, and so I only had maybe about 10 hours of physician shadowing, but at that point I already knew I wanted to be a doctor, so it was kind of just for the application process of it. And I did have some internships. I was working at a pediatric psychology center in next to Johns Hopkins, and so that had to be canceled as well. So I think just, yeah, there's been a lot, I guess, has been canceled. I was going to do some healthcare employment this fall after applications had been submitted, but again, it's been suspended, been postponed. Everything's kind of just up in the air right now because of COVID. So, oh yeah, I guess I know college is hard. I'm not gonna sugarcoat it, I guess, but it's worth it in the end. My mom would always say, because I think I'll probably be done with school by the time I'm 30. She says, one day you're gonna wake up, you're gonna be 30, you can be a doctor or you cannot. And so just, I guess, keeping just having a strong belief, I guess, in your dreams, and even when it gets hard, just keep with it.